Hi, I'm Dr. Julie Prutsman, and thank you for tuning in to Sound Relief Tinnitus and Hearing Center. If you're watching this video, you're likely preparing for a hearing test, or maybe you've had an evaluation that left you with more questions than answers. Either way, it's important to understand this. Not all hearing tests are created equal. Unfortunately, many people are given a quick screening in a noisy room, asked to respond to a few beeps, and then rushed into a one-size-fits-all solution. That's not a proper evaluation, and it's certainly not the kind of care you should settle for. At Sound Relief, we believe that every hearing test should be comprehensive, precise, and tailored to you. So in this video, I'll walk you through what to expect during your appointment, highlight the advanced testing we perform, and share a few red flags to watch for if you're ever offered anything less. We want you to feel informed, confident, and empowered, whether you're seeing us for the first time or just looking to better understand what gold standard hearing care really looks like. Because ultimately, this isn't just about detecting hearing loss. It's about getting to the root of your challenges, creating a plan that truly helps, and reconnecting you with the people and moments that matter most. Many people think of hearing loss as a minor inconvenience, just part of getting older, something to put off until it becomes bad enough. But the reality is, untreated hearing loss doesn't affect just your ears. Whether you realize it or not, hearing loss can affect your brain, your relationships, your confidence, and your overall well-being. You may have been wondering, do I really need to address this now? Or if I'm getting by, what's the harm in waiting? Here's what we want you to know. Hearing loss doesn't stay still. Over time, the brain receives less stimulation from sounds and speech, which can lead to cortical reorganization, a physical change in the way the brain processes information. This lack of input and reorganization of resources can increase the risk of cognitive decline and contribute to symptoms of dementia and Alzheimer's disease. It can also lead to social isolation as conversations become more exhausting and less enjoyable, mental fatigue as your brain works overtime just to keep up, frustration for both you and your loved ones, and an even higher risk of falls due to diminished spatial awareness and balance cues. Hearing loss may start small, but its ripple effects can be wide and deep. Ultimately, the longer it's left untreated, the harder it can be to regain lost clarity and confidence. That's why we recommend regular hearing evaluations starting around age 50, even if you think your hearing is still pretty good. Catching changes early gives us more tools, more flexibility, and more time to intervene in a way that's proactive, not reactive. Because when we address hearing loss early, we're not just protecting your ears. We're protecting your brain, your independence, and your connection to the world around you. Real quick, I want to address a few misconceptions about hearing care. If I needed hearing aids, I'd know. Hearing loss often happens gradually. Many adapt without realizing how much they're missing until they're exhausted from trying to keep up or feel left out of conversations. Others don't recognize the hearing loss, but their spouses, family, and coworkers certainly do. If you say, "What?" or "say that again" on a daily basis, it's probably not the people around you, and a thorough evaluation will reveal the true picture. While they're a powerful tool, hearing aids are just one part of the solution. Success depends on proper programming, patient education, and consistent follow-up, all things we take very seriously. Many patients also need auditory training to help maximize their brain's ability to decode new information. We utilize an app for our patients called Lace AI Pro to help them achieve maximum benefit from just 10 minutes of daily auditory training. All hearing providers are the same. They're not. At Sound Relief, you'll work with doctors of audiology who take the time to understand your unique hearing profile and guide you with experience, transparency, and care. Our testing is more comprehensive, our visits are longer, and our support doesn't stop once devices are fitted. I can buy the same hearing aids online or at Costco for less. While some devices might look similar on the surface, The differences lie in the computer chip technology, the programming, the support, and the expertise behind them. Costco, for example, only has access to older technology, which is why they sell their hearing aids at a discount. Also, hearing aids are only as good as the audiologist who fits and fine-tunes them for you. At Sound Relief, we don't just hand you a device. We guide you through a customized process to ensure the settings match your hearing profile and lifestyle, and that you gradually adapt to your full prescription. Today's hearing technology is more advanced and more varied than ever. Features like deep neural networks, 4D sensors, Bluetooth streaming, rechargeable batteries, directional microphones, and background noise reduction vary widely by make and model. Your hearing loss, listening environments, and personal preferences all play a role in choosing the right technology. It's not one size fits all, and it shouldn't be, since no two brains are the same. Misconception number 6. If I wear hearing aids, people will notice and treat me differently. Modern hearing aids are discreet, sleek, and in many cases, nearly invisible. And here's the truth. People are far more likely to notice when you're disconnected or answering questions inappropriately than when you're wearing hearing devices. We focus on making sure you hear well and feel confident doing it. Hearing aids are too expensive. While hearing aids are a significant investment, we offer a range of pricing options and will check your insurance benefits before your visit. We also work with financing options like Care Credit. We aim to make hearing as accessible and affordable as possible without compromising on care or quality. Patients who have worn hearing aids before will tell you that it matters most who you get your hearing aids from, and you definitely get what you pay for. Misconception number 8. My doctor said I hear fine for my age. There is no such thing. Even mild hearing loss has been proven to cause cortical reorganization in the brain, which is why early intervention is key to avoiding long-term negative effects, such as social isolation and depression. Like most everything with your health, prevention and early intervention will result in the best long-term results. What to expect at your appointment. Your first visit will last about 90 minutes and includes a comprehensive diagnostic evaluation with one of our doctors of audiology. At Sound Relief, nothing is ever rushed or off the shelf. We take the time to get it right because no two ears and no two brains are the same. This isn't a quick screening or a sales pitch. It's a detailed, thoughtful process designed to uncover exactly what's going on and how we can help. Here's what we'll cover during your appointment. Number 1, case history and conversation. We'll begin by listening, really listening to your concerns, your health history, and your lifestyle needs. If you've noticed hearing challenges or if a loved one has commented, we want to understand how this is affecting you daily. If your loved one would like to join you for your appointment, we would love to have them attend to learn more. Number 2, otoscopy. We begin with a visual inspection of your outer ear and ear canal using a high-resolution video otoscope. This allows us to clearly examine the ear canal and eardrum or tympanic membrane for any visible concerns, such as wax buildup, irritation, inflammation, fluid behind the eardrum, or even foreign objects in the ear canal. What makes this different at Sound Relief is that you can see exactly what we see in real time on a screen in a sound booth. Patients often find this part fascinating because it's not every day you get to look inside your own ears. And it helps build trust in the process when you can visually confirm what we're describing. If we find excessive earwax, which can contribute to hearing difficulties, tinnitus, or discomfort, we'll carefully and safely remove it using professional tools designed for this purpose. In some cases, removing a wax blockage can lead to an immediate improvement in hearing clarity and reduced tinnitus. This step ensures we have a clear view of the eardrum before proceeding with any other diagnostic testing. A clean, healthy ear canal is essential for accurate test results, and it's an important part of ruling out simple, treatable causes of hearing changes before we look deeper. Number 3, comprehensive hearing evaluation. This is where we gather a complete picture of your hearing health. Rather than relying on a quick screening or a simple beep test, we perform a full battery of diagnostic tests that evaluate how your ears and auditory system are functioning, from the outer ear all the way to the brainstem. Here's what's included. Air conduction testing. Using soft tones delivered through insert earphones in a soundproof booth, we determine the quietest sounds you can hear across a range of frequencies or pitches. This helps us identify the degree of hearing loss: mild, moderate, severe, or profound. Bone conduction testing. A small device is placed behind the ear on the mastoid bone to bypass the outer and middle ear to stimulate the inner ear directly. This tells us whether your hearing loss is sensory neural, or in the inner ear, conductive, or in the outer or middle ear, or both. Knowing the type of hearing loss is critical for choosing the right treatment. We present spoken words at various volume levels and ask you to repeat what you hear. This helps us understand your ability to detect and understand speech clearly, a skill that often declines the longer a hearing loss goes untreated. It also allows us to determine your speech recognition abilities, which provides insight into how well your brain is processing sound. Speech and noise testing. We introduced real-world background noise, like the hum of a restaurant or multiple speakers talking at once, and evaluate how well you understand that speech in a more complex environment. This is where many people with early or moderate hearing loss begin to struggle, and why it's such an important part of the evaluation. Tympanometry. This quick, non-invasive test measures the movement of your eardrum in response to slight pressure changes. It helps detect middle ear problems, such as fluid buildup, negative pressure, eustachian tube dysfunction, or perforated eardrum. These issues can often be treated medically and typically need to be addressed before we move forward with any hearing devices. All of this testing is done in one of our comfortable, soundproof booths with specialized, regularly calibrated equipment to ensure accuracy. By the end of the evaluation, we'll know not only how much hearing loss is present, but where it's occurring and how it's impacting your ability to communicate. This level of detail allows us to tailor treatment to your specific needs and ensures you receive the most effective, personalized care possible. If you already wear hearing aids, we'll check their function and run real ear measurements to verify that the devices meet your prescriptive targets with specialized equipment. If hearing aids are recommended, we'll demonstrate how they work and allow you to experience the difference they can make when tailored to your hearing profile. This level of testing gives us a complete picture of your auditory system. Not just whether you hear beeps, but how well the amplification meets your prescription to achieve maximum clarity. After your appointment, whether it's with us or another provider, you deserve to walk away with more than just numbers on a chart. You should expect a clear explanation of your test results in language that you understand, a thoughtful conversation about how these results relate to your daily challenges, and, if treatment is recommended, a plan that reflects your unique hearing needs, lifestyle, and goals, not just a product. If hearing devices are part of your treatment, you should never feel pressured or rushed into a decision. Sometimes, when you know something is good for you, you know it immediately. Other times, our providers may offer you a chance to test the recommended solution in your real-life environments, like at home, at work, and in conversations with family and friends, so you can provide feedback and ensure it's the right fit for you. An audiologist worthy of your trust will view this process as a collaboration, not a transaction. They'll take the time to listen, adjust, and support you, not just during your first visit, but throughout your hearing journey. You should also expect transparency about pricing and what's included in any ongoing care, help with navigating your insurance benefits or financing options, clear sense of what follow-up will look like, including adjustments and ongoing support. Whether you're coming to Sound Relief or seeing another provider, these are the standards you should hold any hearing care professional to. You're not just investing in hearing aids, you're investing in the quality of your care and the people guiding you. Better hearing is more than just turning up the volume. It's about clarity, connection, and confidence. And it begins with the right evaluation, the right guidance, and the right partnership. At Sound Relief, We're committed to delivering care that's never rushed or off the shelf. But even more importantly, we want to empower you to recognize what high-quality care truly looks like so you can make informed choices wherever you go. If you have any questions before your appointment, we're here to help. And after your visit, I'd love to hear how it went. Please feel free to send a quick note to Dr. Julie at soundrelief.com to share your experience or let us know how we can improve. Thank you again for taking this important step. We can't wait to meet you soon.